All right, this is Dr. T from Thousand Oaks. I today want to present a case that we did recently in our clinic, um, highlighting partial knee resurfacing robotically. This case compares a robotic knee resurfacing to a manual technique. So partial knee resurfacing has been around for some time, many decades. In the beginning, the techniques were usually manual, meaning that we used manual instruments to place the implants to make alignment and to get positioning. As technologies improve, now we have robotic technology. So this is going to highlight a particular individual who came in for a knee problem. We're going to review his symptoms, the x-rays pre-surgery, the examination findings, and then the x-rays post-surgery, and then a discussion about the case. So the patient is a 63-year-old. He came in for left knee pain. He had bone on his left knee. He was told by another surgeon that he needed some form of knee surgery. He had already had a right partial knee replacement done by another surgeon. He was not necessarily happy with that right knee, so I think he was seeking another surgeon, maybe for the second knee procedure. And so it's important for me when I evaluate patients to always check to see what what their happiness level is with the first surgery they had. So if they had, for example, something they're not happy with it, I would be reluctant to do the same thing. Maybe there was something wrong with it, so I'd want to identify that before. And he wasn't happy with his right knee. However, he was a perfect candidate for this partial knee replacement. So these are the x-rays that we took. We usually take 4 x-rays. It's really important that weight-bearing x-rays are taken. That's what this WB stands for. This is what's called the extension view. This is what's called the flexion view. There's a lateral and a sunrise view, which are not really relevant in this case, so I didn't include them. But these are weight-bearing views, both in extension, which is this view, and this is in flexion. It shows bone on the inside of his left knee. And it also shows that there is preservation of the joint space in the outside of the knee. The lateral compartment is intact. The medial compartment is bone on bone. So he's definitely a good candidate. You can kind of see his legs, so he's not like heavy. So that's also another criteria. He's not overweight. That's a contraindication for a partial knee replacement if somebody's too heavy. And he meets all the other criteria that we use to select partial knee candidates. However, he wasn't happy with the right one, so I had to, evaluate the right knee. So if you look at the right knee, which is on the other side, you can see the white, which is the metal implants, and this flexion view shows it super clear, but you can see how this right implant is nearly halfway off the lower implant. So the femur is nearly halfway off the tibia. So there's an alignment issue here. You could also see right here, like the lateral aspect of the femur is shifted relative to the tibia. So there's some misalignment going on here that was probably done surgically, unfortunately for him. So when I reviewed these x-rays, I said to him, look, you're a perfect candidate for a left knee partial resurfacing. However, the reason why you don't like the right one is because it's not done right, and then it's not lined up properly, and that's why you're having pain and problems with it. So I pointed it out to him. So this just shows it again. So you can see how the right femur doesn't line up properly with the tibia on the extension view. It's worse. You can see it here on the flexion view. And then the left knee shows this bone on bone here. So I said, hey, you're a perfect candidate for a partial replacement. The reason why you didn't have a good outcome is because of an alignment. So if we get you good alignment, you're going to be completely happy with a partial knee replacement or partial knee resurfacing. And so he agreed with the plan. So we proceeded with a robotic partial knee. And so this is what it looks like after the left partial knee robotic surgery. And you can see how the femoral component perfectly lines up now with the tibial component. The tibia component is parallel to the floor, which is perpendicular to the long axis of the tibia. You don't see any misalignment on the lateral side. You still have lateral preservation. So I would consider this, a perfectly executed robotic partial knee resurfacing, and he sailed through this operation within 4 weeks. He was super happy, but unfortunately, he was still having pain on his right knee. So if you go back now, compare what it looks like. This one was done manually. This one was done robotically. So you can clearly see there's a difference between the alignment of the two components, and this is the reason why he has pain. So the only solution now is to redo this partial knee replacement that was done manually. Now, unfortunately, once it's kind of botched, it's hard to go back and redo this because once we take these implants out, we don't have a lot of bone to work with. And so when somebody has a failed partial knee replacement, rarely we can salvage it. More commonly, we have to revise it to a total knee, and that's what we did. So we revised his partial manual knee to a total knee replacement. So we replaced all parts of the knee. So that's the difference. You can see the medial side and the lateral side are replaced with this one device on the femur, and then you have this tibia. Now, what's unique about this is it has a revision stem, which we use for people who've had who need revision surgery. And the reason being is because he had this tibia part removed already, we had to make up with that with a little block of metal. So you can see how the thickness of this metal is wider on the medial side. That's because he had that previous surgery, so there was a little bone loss there. So we make that up with a little block, and then we have to stabilize the upper tibia surface with the stem. So it went really well for him. I mean, it turned out good. He's much happier with this total knee now than he was with his partial knee. The unfortunate thing is that once you've had the surgery the first time, and then we go for a second operation, the outcome is not quite as good. And so that's why I think robotic surgery is so much better than manual surgery. And this is validated as well in our literature. So this is from an article from 2016, Journal of Bone and Joint Surgery, which is our primary orthopedic journal. It's peer reviewed, and this is a prospective study, randomized control. So these kind of studies are what's most important. So double-blind, prospective, randomized. So that means that there's two groups of people. There was, say, 200 people that needed partial knee resurfacing, and they picked out of an envelope. One person was selected for robotic, and the other person was selected for manual. And the surgeon didn't choose, and the patient didn't choose. They were just selected from an envelope, and then that surgery was executed. And so when they compared the robotically assisted to these manual standard ones in a large number of people, they found the conclusion, which was robotic assisted surgical procedures with the use of Mako led to improved accuracy of implant positioning compared to conventional unicompartmental knee arthroplasty surgery techniques. And conventional means manual, like the manual instrument. So we know that robotic surgery definitely outperforms manual surgery, specifically for partial knee replacement. Unfortunately, we know if you've had a previous surgery done unsuccessfully and we have to convert it, the outcome for a revised knee is not as good as if we had the first shot at it. So the first shot will usually give you somewhere in the mid 90s, the high 90s satisfaction rate. And a revision of a botched surgery is going to get you somewhere in the 85%. So it's important that, somebody who is a candidate for one of these operations, does their homework and chooses the right surgeon performing it with the right techniques. And the way medicine is and the way orthopedics is there's multiple specialties within orthopedics. The two that are relevant to the knee are joint replacement and sports medicine. Sports medicine trained people that are exclusively sports medicine trained are not necessarily trained in performing joint replacement operations. And traditionally also joint replacement surgeons are not historically trained to do sports types cases. However, there are hybrid training, and there are individuals who have that, like myself, who is kind of dually trained both in sports medicine and joint replacement, because traditionally, like, partial knee replacement falls under the category of sports medicine, and full knee surgery falls under the category of joint replacement surgeons. Two separate specialties, but there are individuals who basically do both, and that's kind of what I do. So that way, if somebody comes in and they're a candidate for one thing, I'm going to provide them the partial if they need it. If they need a full, I'll do that. If they need a revision, I'll do that. It's like the sports guy won't revise that, and that's where the problem is, because if that individual who had the partial knee replacement went back to a surgeon, and if the surgeon said, hey, something's just not right, we need to revise this to a total, that surgeon doesn't do that surgery. He's not trained for that surgery. So he just, well, that's as good as we can do. Well, it's really not. It should be better. So that's just kind of where there's an issue with the specialist that you choose. So you got to do your homework and pick the right surgeon the first time, because your outcomes will depend on that. So if anybody's interested to have me look at their knee replacements, or if they have any knee questions, we're available through email, through telephone. You can make an appointment. We're in Thousand Oaks. We'd be happy to give you an evaluation. All right, everybody, have a good one. Bye-bye.